Then last one, we have quality accreditation in healthcare, which is very much important and nowadays very much important in healthcare. Finally, we are discussing, as you know, the healthcare quality accreditations, where we will see the definition of quality accreditation as per ISQA. Accreditation is a self-assessment and external peer review process used by healthcare organizations to accurately assess their level of performance in relation to established standards and to implement ways to continuously improve the healthcare system. According to the World Health Organization's WHO, accreditation can be the single most important approach for improving the quality of healthcare structure. So it is one of the essential requirements of the hospitals nowadays. So what are the objectives of accreditations? We have to see the main objectives. The main objective of accreditations are to ensure the quality of healthcare through the application of quality concept. Then to foster a culture of patient safety and minimize the risk of medical errors, to achieve optimum organizations results with available resources, and to increase accountability to patients and identified stakeholders. The SIBAHI accreditation, the local standards, which is Saudi program for healthcare providers. The Saudi Central Board for Accreditation of Healthcare Institutions, the SIBAHI, accreditation standards were developed by a consensus process of healthcare experts representing Ministry of Health, National Guard Hospital, KFSSRC, university hospitals, private hospitals, security forces hospitals, Saudi Council for Health Specialties, and MRQP team. The standard have been approved by Dr. Hamed Al-Mani, Minister of Health, National Standards, the Preparation Committee on 20 to 24th May 2006. Then next we have Joint Commission International Accreditation Standards, where we have different type of accreditations given by United States of America. Accreditation standards related to the patient-centered, and we have also management standards. So the functions related to provide patient care access to care and continuity of care, access assessment and continuity of care, patient and family rights, patients' rights and educations, patients and family education. We have assessment of patients, management of medication. We have care of patients, COP. Healthcare organizations and management standards we have in Joint Commission International Accreditations are functions related to providing a safe, effective, and well-management organizations, that is quality improvement and patient safety, that is continuous quality improvement. Then we have PCI, that is prevention and control of infections, that is for hospital infection control. Then we have GLD, that is governance, leadership, and directions, that is responsibilities of management. Then FMS, we have facility management and safety, and SQE, that is staff qualification and educations, that is related with the human resource management, and management of informations, of course, related to information management system in the medical record and etc. The accreditation process, we have to see the different type of activities. We have to start the accreditation process by education, educate the leaders and the managers, and explain the benefits, advantage, process, timeline, etc. of the accreditations to everyone in the hospital. Then we have to go for the baseline assessment, use knowledgeable and of course the credible evaluators, either internal or external consultant, who will basically critically and objectively assess each areas and conduct a detailed baseline assessment of organizations, the current adherence to standards, and each measurable element score as met, partially met, of course, and we have not met, and cite specific findings and recommendations. Then we have to go for the action planning. Using the findings of the baseline assessment, develop a detailed project plan, starting first with the priorities areas of the core standards, responsibilities, deliverables, and time frames should be assigned. Example, revise informed consent policy, develop a new informed consent statements, educate staff in the next 2-month time period or maybe 6-month time period. Then we have to go for another called chapter assignments. Look for good people skills, time management skills, and consensus building skills, and assign oversight of each chapter of standards to a respected champion or leader who will identify team members from throughout the hospital and carry out the process. Then we have policies and procedures, Of course, in addition to an overall project plans, it is often helpful to compile a list of all required policies and procedures that will need development and revision. Continue to monitor your progress in meeting the standards, such as through a mini evaluation of each chapter at regular intervals, maybe the quarterly. So it is very much important to understand. Then we have next is final mock survey. It is the activity within the hospital. After the 6 months, we have to go for the mock survey. You can use the third party or maybe internal evaluators, or sometimes you can ask the external consultant who are not involved in the baseline assessment and preparations, who will look at the organizations with a fresh and objectives eye, plan final revisions and corrections based on the findings of the final mock survey. Then we have the final survey. The success of the quality assurance program depends almost entirely on the commitment and interest of the administrations, nurses, paramedical staff, and physicians. Of course, leader of quality assurance program must be able to generate interest and commitment without burdening the clinical and administrative staff with an activity they neither understand nor believe. This will help more quality assurance about its current the paralysis in some hospitals. Quality assurance is to succeed in its goals to identify and correct problems and to improve the quality of patient's care. So the healthcare quality accreditation is one of the major areas nowadays in the hospital. Everyone should look after this one, and this is the mandatory, like Sipahi is the mandatory accreditations program in Saudi Arabia. So every hospital should think about the hospital accreditations. Thank you.